So what exactly is insulin and why is it so important in diabetes? Insulin is a hormone that's released by the pancreas and it has a vital role in the last step of carbohydrate metabolism. So when the glucose is transported to different cells, insulin acts as the key which unlocks this cell and allows glucose to enter the cell so that it can be utilized as energy. So if anything goes wrong in this step, the glucose will remain in the blood. It will get locked out of the cell. Two main types of diabetes which we'll be discussing is type 1 and type 2. In type 1 diabetes, there is a deformity or disorder of the pancreas where it doesn't produce enough insulin or it doesn't produce insulin at all, and so you will have increase in blood sugar level. This type of diabetes is actually an ancient disease. It's been present in ancient Egyptian texts, we can find it in ancient Greek texts, even in ancient Indian texts. They all describe this version of diabetes. But type 2 diabetes is something which is more modern. It's been increasing exponentially in the last few decades. And unlike type 1 diabetes, it's almost purely environmental and lifestyle related. So what is type 2 diabetes? In type 2 diabetes, the pancreas is producing insulin as normal, the insulin structure is normal, everything is fine in that sense. But the body cells themselves become resistant to the insulin. So the body produces more and more insulin to try and make it work and force it open. For a while that does happen, but then it's not able to keep up with this excess of sugar, and so you get resistance. So this is basically how insulin plays a role in the pathology of type 1 and type 2 diabetes.